Influenza, or most commonly known as the flu, is an infectious disease of the mammals. It is caused by the influenza virus and it is viral in nature. The flu affects the respiratory system in humans, including the nose, lungs, and throats. There are many types of flu viruses, and A and B are the ones that most commonly affect people. About 5 to 20% of Americans will contract the flu this year, and there are about 36,000 flu-related deaths in the United States per year. Most of these diseases will occur in individuals over 60 years of age or those with underlying heart or lung complications. There are many risk factors that can help contribute in getting influenza each year. Some of them include age. Those that are young children and those that are elderly are more likely to get influenza. Also, job plays a big role in getting influenza. Healthcare workers and child care personnel are more likely to get influenza. Those living in close living conditions are also readily contracting influenza, such as those kids who are in college dorms and prison barracks. Those that are immunosuppressed are also likely to get influenza, such as those that have AIDS or are on immunosuppressants. Pregnancy is also a big factor, and women in their second and third trimesters are more likely to get influenza. The flu is an illness that has no stratifications based off of gender, age, or racial ethnicity. It can happen to anybody and at any time. It is really important for us to know about the signs and symptoms and how to treat it. It is relevant to the Houston Baptist University community because it is a highly transmittable disease, and one of the risk factors for getting the disease is living in highly crowded areas, such as colleges. Heading to you live is Dr. Estefania Vasquez at the Houston Baptist University Hospital with the first influenza patient of the season.
Good afternoon, this is Dr. Vasquez. We are here at HBU Hospital in the emergency department. We have our first case of influenza this season. We're going to go take a look at the first patient. Hi, my name is Ms. Vasquez.
Hello.
I'm going to be taking a look at you. How are you doing today?
I feel horrible.
What are your symptoms?
My body aches. I'm really cold. And my nose is stuffy. I just feel horrible.
All right, well, first let's check your temperature real quick. See how. All right, under your tongue. Okay, guys, so she has a temperature of 102.4, and that's typical in influenza Yeah.
I think it started yesterday. I was fine and it just started out of nowhere.
Okay. All right, well, let me take a listen to your lungs real quick. Can you come up for me a little bit?
Mm-hmm.
Thank you. Okay. So I'm hearing diffuse crackles, which is normal in influenza. Signs and symptoms of influenza are like the regular cold. So you'll have fever, sore throat, runny nose, muscle pains, and it's typical for the patient to be like feeling very weak. Signs and symptoms usually last 7 to 10 days. So we are thinking that you have influenza. At this moment, the rapid test, that would be like the results will come in between 1 to 15 minutes, is the throat swab. So we'll just put this swab in your throat and just take it a sample, or it could be the viral culture, which would take up to 10 days.
Let's just do this swab.
Diagnostic tests we have for influenza are viral cultures, which the results come in from 3 to 10 days, and we also have the rapid flu test, which is what we did on Maribel. We did the throat swab, and the results that we have for that are given between 15 minutes. Swab. Okay, can you please open your mouth? Okay, Ms. Maribel, your test came back positive.
What does that mean?
You have influenza.
What can I do to get better?
Okay, we're going to go ahead and treat it with antivirals, and we're going to go ahead and give you something to treat your symptoms. We're going to treat your fever with Tylenol and your muscle pains. That's going to get rid of those. And we're also going to give you fluids, which the nurse already started your IV, and you'll be all set. We have for influenza are antivirals in some cases, which we usually try to give them ideally within 2 days of the onset of the symptoms. And we also have Tylenol to treat the symptoms like temperature or muscle pains. And we also want to give them normal saline or lots of fluids by mouth. Right, so Maribel was provided with discharge instructions, so now we're going to go ahead and test her, all right? Hi, Maribel.
Hi.
I'd like to know what you learned about prevention for next season about influenza.
Well, from what I understood, in order for me to prevent it in the future, I have to get a vaccine.
Okay.
And there's 2 types of vaccines. They have the nasal vaccine, and they have one that's given by shot, so in the muscles. And I cannot cure it, so I'm only getting my symptoms treated.
Wow.
So in the future, I'm just gonna get my shot to prevent this.
All right. Great.
Okay, so the disease affects multiple dimensions of health. So some complications that can occur with influenza are you can get asthma flare-ups. If you have asthma, you can have pneumonia. You can also have bronchitis, ear infections, and sinus infections. However, the main complications is pneumonia, and that's especially a big complications for older adults with chronic illnesses. And pneumonia can lead to death if not cured. So it is very important to get your influenza vaccine. Okay, many people don't think that influenza is such a big issue. However, it can become one because of the complications I mentioned earlier. So one of the things we can do for the patient and for the provider is we can help them relieve some stress. As with any illness, stress can be one of the things that arises. So we can help them by telling them to maybe take a walk to release some of that stress, get a good night's sleep, and eat a healthy diet. Those are some of the things that we can do. Some things that we want to teach our patients is our main goals is to prevent influenza. So some of the things we can teach them is have good cough and sneeze etiquette, having a good hand hygiene, and avoiding crowds. And make sure to always get your flu vaccine. Some additional information about the flu vaccine is that the CDC recommends that the first and most important step in preventing it is to get the flu vaccine. So everyone that's 6 months and older should get a flu vaccine in order to prevent it. And so they should get it as soon as the new vaccine is available.